Sorry about that. I'll try to make it quicker. You may be on medication-assisted therapy, and I would like to know how you feel about that. Some of them do mean that you're still addicted to that medication. I personally take kratom. There is a slight little bit of withdrawal from that. How do you feel about that? I am okay with it, because I can function, and I do have pain problems. So, that's a little bit about the drowning effect. The drowning effect can actually last a long time, but I really need to hear from you guys who fit into this somewhat broad category. I want to know how society can improve both mental health and addiction treatments, which I intend on getting as much info and experience information and input to present in coordination with support from clinicians and psychiatrists and whoever I need to introduce and incorporate this method of treatment. I have that incorporate these treatments, the treatment I have, my program, either into its own or incorporating into other programs which already have single-digit percentage success rates anyway, so they don't work. Some places that are rehabs have what's colloquially known as a revolving door. They just use you for your insurance and just kick you out before you're ready, in and out, in and out. That's horrible, and there needs to be reform to this. Anyway, I believe in a more comprehensive and more hands-on approach, and it's okay if you really do need someone to hold your hand the entire withdrawal or detox. An idle mind is our own worst enemy, especially if one is left to just be to their own devices, not to relapse. You do have to want to get clean still, but this model I'm coming up with and already have pretty much laid out in my mind anyway, just needs to be put on paper, and I have clinicians critique it. My main differences from most existing programs would be that mine could be characterized as being able to see and remind the patient and help to bring out that patient's personal value and for them to see it again. It can take time doing this on our own to be able to see our personal value, or maybe what our purpose is, or whatever it is you need to keep to be able to hold on to, because you've just been holding on to drugs, the dope, whatever the fuck you've been taking, and you got to replace it with something that feels productive a lot of times. A rejection of tough love processes due to, like I've said before, poor results. And there are some programs out there that are helpful, but not for everyone. Not one treatment is this is going to be the same for everyone, but I do think this is going to be good for those that fit in this category. I'm going to give you guys some statistics and links with this video. I'll probably try to include it in my other video too. I'm sorry this is in 2 parts. Didn't intend for that. Let's see, almost done anyway. Whatever the substance, addiction impacts the lives of millions. Between 1999 and 2017, over 700,000 overdose deaths. Since 1990, overdose deaths have tripled from the previous numbers. It costs $600 billion annually to the economy due to drug and alcohol related issues that could be addressed directly in programs that work. That means 21 million Americans have at least one addiction, but get only 10% But yet only 10% of those people receive treatment, or about 2.1 million of the 21 million. 20%, 2017 saw 34.2 million DUI offenses, 21.4 million under the influence of alcohol, and 12.8 million under the influence of quote-unquote drugs. I don't like that term, but whatever. Other intoxicants. Over 90% of people with an addiction started to drink or use drugs before they were 18 years old. Americans age 18 to 25 are the most likely demographic to use addictive drugs. 20 million Americans have a substance abuse disorder, but only 4 million of them receive treatment. Typically not because they don't want it, but because of access to treatment, stigmatizations, being not only very poor, but of very, very poor quality, but also rather scarce. It's not easy to find a good quality place to go for, you can go one place for methamphetamine, but they don't offer help for heroin addiction. It's weird. We got another little bit here. Since 1971, the Substance Abuse and Mental Health Service Administration, or SAMHSA, has tracked the rates of substance abuse disorder in all 50 states and D.C., but has never included questions related to the most important, most positive possible outcome of having a substance abuse disorder: recovery. So Harvard's John F. Kelly, who directs the Recovery Research Institute, will work with the National Recovery Study, will provide recovery rates at the national level, but still needs to have some improvements, like incorporating regional and local estimates. And I'll provide more links to this when I post the video. I'm going to be posting, like I said, links to these statistics and other addiction and recovery links, because I don't want to make this video too long or too large, because it's already in 2 parts. Drugabuse.com defines drug addiction as a chronic disease that affects millions, characterized by intense drug cravings and inability to control drug use despite negative consequences. This can happen to anyone, but will not happen to everyone. Regardless of that fact, whether that's your drug of choice or is a prescription or an illicit one, 1 people out of 12 reported having a substance abuse disorder the previous year in a 2014 study. And guys, I really need you guys to interact with me so I can do more. I'm kind of running out of ideas. I need some interactions, so please subscribe, share, and give me some ideas, and throw something out there. We can talk about it. No bad ideas. Alright, well, stay safe, stay clean, and contact someone if you need help. You can contact me if you need help. For real, I mean that. Anyways, please subscribe to the Mental Health and Addiction channel. Thank you.